the right conditions, the human body would not get sick, old, and die. This is not just a pipe dream. Our bodies are wonderfully made by a thoughtful creator with the amazing ability to heal itself. So why then do we get old and die? Well, that's a topic for a whole nother day. Today we're going to delve into how wonderfully we are made and self-heal with Dr. Teresa Cody and her book, You Healing You. You're watching Books with Bridgetti. Don't go away. We will be right back.
Thanks for having me on your live show. It was really my pleasure. Your production is just fantastic. Unbelievable how you guys are pulling that off. So organized with segments and transitions and all those different things. Right in line with what I'm talking about in my new book, Going Live, live streaming your podcast to reach more people. Hopefully people tune in for our conversations. Definitely worth the on-demand version, in my opinion, if I may say so myself. You guys are awesome.
I think this might be, I've been on over 24 different podcasts and radio shows in the last couple of months, and this has to be one of the most sophisticated, what the kids that I used to teach call bomb.com shows and presentations that I've ever been on. It looks fantastic. Thank you.
I love your introduction. How professional. That sounds, I feel like I'm on a beautiful show here.
Folks, welcome.
Available wherever great books are sold near you.
Oh my goodness, Ross, thank you so much.
Thanks. And, this is one of the most fun interviews that I've ever done. So thank you, Bridgetti.
Big pleasure. Ross, take care.
Thank you.
If you've just joined us, then welcome. You are watching Books with Bridgetti, and my amazing guest today is Dr. Teresa Cody. One of the things that we do on the show is help people level up when they go live. Now, a lot of authors and many others out there still use the online method to talk about their books and their journeys. And so a lot of authors go live simply using their phones, and there's nothing wrong with that. The cameras on our mobile phones are simply amazing. So one of the things that you would normally do, especially if you're going live to talk about your books either on TikTok or Instagram, is use your phone in portrait mode, and that's 100% correct. But here's a quick tip for you. If you are going live on any of the other platforms to talk about your books, turn your phone into landscape mode. This will avoid those typical black lines you'll see on the sides. And if you wondered what those black lines are, that is why. So simply, if you're going live on another platform, use your phone in landscape mode. That'll increase the screen that you've got available. You can comfortably use your hands while you're talking, make gestures, interact with the audience, eye contact. And then the other suggestion that we've got to help you level up when you are live talking about your book is do put your phone on a tripod, any kind of tripod to secure your phone, because it's really hard to be able to hold your phone 100% still in your hand. It's not possible while you're talking. Hold your book, be animated, grab a tripod, any tripod of any kind, any stabilizer, anything you can find. And if all else fails, tape your phone to a window. Make sure that you've got front-facing lighting. If you've got lighting coming from the back, people won't see you. It'll sort of black you out. It won't look great on camera. So always make sure that you have front-facing camera. If, of course, you are already on a computer or a laptop and you simply want to level up, you could invest in something like a separate webcam. I recommend the Logitech camera. I've used 3 or 4 of the Logitech ranges. The one I use now is the Logitech Brio with right side light technology, which means it'll automatically adapt to lighting conditions. But today we want to talk to Dr. Teresa Cody about her book. She's been running a dental practice with her husband, also a dentist, since 1993. And she says through a sequence of extraordinary events in 2018, which we'll ask her about, she discovered the healing power of platelet rich plasma, or PRP, found in blood plasma. Now, most people are unaware of its amazing healing powers, and this prompted her to write her book, You Healing You. She founded C&C Wellness in 2019 to fulfill her passion to introduce people to the numerous benefits of PRP treatments. And so, without any further ado, let's welcome Dr. Teresa Cody to the show. Teresa, welcome. I'm so happy to have you join us today.
Well, thanks for having
And
me. I really appreciate it.
it's a pleasure. I never get tired of meeting people from all corners of the globe. It's just amazing that we have this technology where we can go live and enjoy conversations like these one-on-one, regardless of where we are, as long as we've got an internet connection and technology works, right?
Right, right.
Sometimes technology
Which,
does fail. It's wonderful when it does work. So tell me,
right.
how did you get into dentistry in the first place? What was it that attracted you to the profession? Is it something that someone else in your family did, or where did your love for dentistry come from?
No, no one in my family was a dentist. Um, I was a biology major, so my undergraduate degree is in biology, and I had actually a horrible dental experience as a child. So you would think I
I
would
think a lot
run.
of people have a similar experience.
Yeah. Well, he he didn't use anesthetic on the kids. There, yeah. And I wasn't a good patient either, so that I feel sorry for him. But
Bad
so
combination there.
when I was in college, I finally went to a dentist who did it nicely and made it okay. And I just thought, oh, this is the way you do it. And I've tried to emulate him ever since. So um, I also I volunteered as a physical therapist assistant in college and realized, I don't like the hospital. So and I'm kind of bossy, so I needed to be my own boss.
Oh my goodness. But I love the idea that you, um, not that you had a really bad experience the first time round, because that's never nice, can leave you scarred for life, but that you actually had the opportunity to have a more positive experience, and then want to use that to help other people. So you're doing dental surgery now for adults and children, children only?
Well, yes, we do for everyone from toddler to geriatric. My office, I actually am retired from dentistry. I
Okay.
I have my husband's a dentist, like you said, and I have 2 associates that work for me, and I help run the business. But I was supposed to be retired, and then I opened a wellness center after I ran into platelet rich plasma. Interestingly, dentists have been using PRP for over 30 years. But the way we use it is you draw blood and you put it through a centrifuge, and the red blood cells fall to the bottom of the test tube. And on top is the plasma. And you can use that plasma in bone grafts. So that's the way we used it. And then you're going to put your implant in, your dental implant. But what we would do is we would use the plasma with the bone graft and then close the area up for 3 months and not disturb it. Now, we knew it worked because if you did a bone graft without plasma or the PRP, you really didn't get good results. But what I didn't know is that it heals everything, everywhere, and
Not just teeth.
not just teeth. And I blame this whole thing on my hairdresser. She's the one that
Can you
started
tell us that
this.
story?
Sure. So I'm sitting in her chair, and she has trigger fingers, and which means there's a bunch of scar tissue here, and she had a lot of pain, and she could make a fist to about this. That's as much as she could close her hand. And she had gotten steroid shots in her hand, and of course it stopped hurting, but for 4 months, only for 4 months. And so I was sitting there and I said, "Why don't we put platelet rich plasma in there?" Now, I don't know why I said it. I mean, and she's been my friend for over 30 years. So she said, "Okay." So I brought her in the dental
She
office,
trusted
and
you.
yeah, well, it is your plasma. That's so it's really I felt pretty good. I knew it wouldn't hurt her. So I brought her in the dental office and on a Monday afternoon, and we drew the blood, put it through the centrifuge, took off the plasma, and I injected her hand. And she asked me, "How long do you think before I see anything?" And I said, "I don't know, 6 weeks." So she said, "Okay, I'll send you pictures." So the next morning, she texts me a picture, and she's touching her index finger and her thumb. And I went, "What?" And she says, "So that was I injected Monday. Wednesday afternoon, she sent me a picture. She was making a fist." And I went,
Wow.
"What?" And that's when I decided I have to know all about this. This is a miracle. And um, that was October of 2018. And then I had an extra office in my office. I had a med spa rent from me, and she didn't renew her lease. And so I took that space over and I made C&C Wellness. And the journey began. I was supposed to be
That's
retired.
an amazing story. Now, just listening to you and your friend, I imagine that that's a typical injury most hairdressers would have from holding the brush, like in that constant motion. They do that sort of repetitive motion every single
All the
day
time.
for hours.
Mhm. And the other thing is, which I didn't know until she told me, is they hold their scissors with their ring finger and their thumb. Now,
Like
why would
that.
you cut with it's the weakest finger. Yeah.
Yeah.
Yeah. But she says, "Well, that's the way we taught." And I was like, "Okay." So that finger was very hurt from all the repetitive motion. But we all have repetitive motion, and the body does not like it at all. My nurse had severe arthritis in her left thumb from turning little tiny, they're called stopcocks on the blood, and they get sticky. And we've treated her thumb probably 4 times in the last 4 years, and she no longer has any arthritis in there. She says the skin feels different on top. She has no pain
Wow.
now. Mhm. Mhm.
Wow. Oh my goodness.
It's
So
the reason I
so now
wrote a
you
book is because I had to tell you. Everybody should
so now
know this.
you've piqued my interest. What other things? Well, to me, first of all, it speaks to the way that we were created with the
Mhm.
ability to self-heal, which is a wonderful, wonderful gift in itself. Um, so I'm curious to know, what other kinds of applications have you used this for?
Well, so I have a nurse and I have an MD on staff, and we have used it for everything you can think of almost. Hurt hips and knees and plantar fasciitis in the feet and rotator cuff injuries in the shoulder, um, arthritis. Um, Actually, my friend had ganglion cysts on the bottom of her feet, and just the other day she said, "Oh, I forgot to tell you, they went away." I said, "Oh my gosh." So that's where the book came in, You Healing You, because I never in a million years would have thought I was going to write a book. But I just started documenting all the things that we've treated. And I was like, people need to know about this because you don't need me. We each have plasma in our coursing through our blood. It's available. I joke, but I'm telling the truth. God made it so it actually works. It does work.
It's yeah, I mean it's you think of the all the medications and stuff that we're taking supposedly to heal our bodies, but it has 10,000 other side effects. It'll fix one thing and break something else.
Hmm.
Whereas if you have something completely natural, um, there's really no side effects because you're not taking in anything. As you said, you're using the person's own platelets. You're not using a foreign body in their bodies. It can be rejected. A lot of people, for example, don't understand why they get illnesses after they've had blood transfusions because they've taken in something that belongs to somebody else. It's not your
Right,
own.
right.
It's a foreign body. And so people years after blood transfusions get horribly sick and they get all kinds of things that they never had before, and they wonder, where does this come from? I've got no history. But it's often linked to blood transfusion that you thought was saving your life. But with the platelets, you're actually using something the person already has in their own body. You're not introducing a foreign material into their body. We'll talk a little bit more about that. We're going to take a very short break. Welcome back. You're watching Books with Bridgetti. We're talking to Dr. Teresa Cody about her book, You Healing You. How did you come up with the title? Was that an easy one?
Um, Actually, I was surprised that it was available because I just one day I said I tell patients, it's just you healing you, and so I was surprised that nobody else had a book named that, but so I lucky for me, I got to use it. um, because the worst that can happen is nothing. Like nothing gets better. We never see that. Um, but sometimes people don't heal completely on one treatment. They come in for a few treatments. but each time it's like they get a whole bunch of healing, because really what we're doing is all in the plasma are uh, proteins called growth factors, but I think they should be called healing factors, because uh, this is the way your body heals, period. This is your healing system. And so what we're doing is concentrating all those healing factors in an area. If you had enough time and enough blood flow, you will heal up. But so we're just using what you naturally heal with and concentrating it in that location. Um, the the healing factors, like people ask me about stem cells. Well, stem cells are undifferentiated cells, which means they can become anything that the body wants them to become. So, but if you had a petri dish of stem cells sitting on the laboratory table, they won't become anything. They sit there and they're stem cells. So, in the plasma, there's a growth factor or a healing factor that attracts stem cells to the area wherever is injured. And then there's another healing factor that directs the stem cell on what to become. Because do you need skin? Do you need a blood vessel? Do you need collagen? And so in the plasma are really the directors of healing. And that's why it works, because it knows what its jobs are, and all we're doing is really concentrating it in an area that it was going to anyway, but we've just added more kind of more guns to the we're just concentrating it. They use this all the time in horse medicine, equine medicine. My neighbor has horses, and I told her that I was opening the wellness center, and I told her about PRP. She goes, "Oh, I know all about it." I said, "What do you mean you know all about it?" She said, "It's the first thing they want to do for the horses, because they have such long tendons and ligaments. And if your horse doesn't get better, you got to put your horse down." So they draw blood from the horse. They do the same process and inject it back in.
That is
Horses are,
amazing. Oh my goodness, that is absolutely phenomenal. So, looking back at that first moment when you had that aha sort of moment, this can be applied for all kinds of different things and going through now. Is there anything that you've come across where it hasn't worked at all? Zero results.
there is one thing. It's called Dupuytren's contracture, and it did help one gentleman, no, two gentlemen with it, and one gentleman it did not. Now it's in the palms of your hands, and these it's like these form these long hard kind of cables, and they pull the fingers in, and he was really very contracted, and it was probably too late.
So you've
Two
probably
other
had it for a
gentlemen.
very, very long time.
Mm-hmm. Mm-hmm. But two other gentlemen, it did help and it calmed their trigger fingers. And then I just saw him again the other day, and 2 years later, he felt like he needed to do it again. Okay, so you get a couple of injections every 2 years. It's really not hard.
Not
So,
at all. I mean, and you have zero side effects.
no, zero. I know. Um, the other thing we use it for, which you'll like this, is we use it for the face, for the skin. So the skin looks is a better texture and less wrinkles and glows. Because I hate to say it, but with age, you lose your glow.
Oh my goodness. So why are people not opting for something as natural as this instead of going for, I mean, you hear some horror stories of people having facelifts and stuff, and this, they come out with unknown side effects, and some people just really look horrible. I've read some awful stories. Oh my gosh. But I don't know why it is. I don't know what your thoughts are on it, but I'm always wondering why people are averse to things that are natural, and always want to go with, I don't know, if it's peer pressure or what it is. But people seem to go for options that are often not very healthy for them in the first place. I can never wrap my head
Right,
around that.
right. Well, I have a big patient base that all they want to go natural. They don't want to. So I don't know. I think there's two teams here, and one side just turns to big pharma, and the other side is running away. But this is about as natural as you can get. It's you. And I mean, we've
Absolutely.
treated Bell's palsy. We've treated, which is a horrible. I, I'll tell you this quick story because my dental equipment rep, he had Bell's palsy for 27 years, and I
Wow.
said, let's try it. So he had such light sensitivity that he could not go outside without sunglasses on. He actually had those glasses that darken, when you go outside, because he really could not stand it. So we treated him. About a week later, he no longer had light sensitivity and hasn't had it again in 2 years. And the other day, about 3 weeks ago, he told me, you know what? I went swimming with my grandson this past weekend, and, I didn't even have to wear any sunglasses. Changes your life.
That is amazing. Teresa, do you know if anybody else does it around the world?
Yeah, there are people who do it. Yes. Um, there are, although I did have a woman who just flew in from California, which I I said I would help her just have them call me. I'll explain how I do what I was going to do for her. And but she couldn't find a practitioner that wanted to try it. It's about the most safe procedure you could ever do, right? You're putting in their own plasma, and the body's loves it. It just latches on. Oh yeah, I want to heal. I just didn't have enough stuff to heal. We find I mean we were treating neuropathies and ligaments and post-surgical. I had a patient who she needed carpal tunnel syndrome surgery. She wasn't sleeping at all. But so she's been my dental patient for a long time and a patient at the wellness center. So what we did was we coordinated. So we took the blood before she had the surgery, and so you can freeze plasma and keep it. They freeze blood, they freeze, so it stays. So we took ahead of time, and then she had the surgery, and on the day of the surgery, I made a house call. So uh, we injected right near the surgery. Did not even take her bandages off, because we have found you just need to be near it. You don't have to be directly on it. It's not
Yeah.
that you just lob it in. It's like a hand grenade, and it just. And so the doctor told her that she would have full strength. It would take about 6 months in both hands, and she recovered in 8 weeks.
Wow.
And she knows. that it was the plasma that did it. But they used to use it in orthopedic surgery. But in
Why?
the
Why do you
US,
say? Why do you say used to?
well, we are run, our medical system is really run by insurance companies.
Yeah.
So, um, insurance companies didn't want to pay for it. So, a nurse told me that she runs a surgery center, a big one, and she said that they told the doctors not to offer it anymore because insurance won't pay for it, and they won't even offer it like have the patient pay. They don't want to even get into that. So, you know, we complained about, socialized medicine, but we have it. It's just insurance, not government, we have to say.
That's amazing. That's amazing. So in
Hmm.
other words, it almost makes you almost gives you the sense that it's all about the money. The longer they can keep you sick, the more it keeps them in business.
Well, we've kind of seen that over the last 2 years, huh? Who made
So
trillions
tell
of
me,
dollars and who didn't?
yeah, that is incredible. Teresa, tell me about a typical sort of consultation. So if a person has got a condition of some sort and they want to um, try the plasma therapy, um, how does, talk me through a typical consultation and how long does it take from the time where a patient makes contact with you and they get the treatment and the results?
Depending on what's the diagnosis is, and a lot of times I don't really care about the diagnosis in a sense that I would try it anyway. I'd have my nurse, because the diagnosis is important on how many treatments they're possibly going to expect to need. But like if you came in for an appointment, we would talk about what is going on. And a lot of times these women are coming to me for aesthetic treatments, for face, for it's called a vampire facial, but it's really plasma, not the red blood cells. And and then they say, incidentally, my knee hurts. So you draw blood, we spin it in the centrifuge for about 8 to 9 minutes, and we draw off the plasma. We've numbed you up, we inject it wherever we need to, and depending on what the injury is, they sometimes, well, I'll give you this. A patient came in and she has a very stiff neck, right? Now, so she told me, so we injected in her neck. And so my parking lot is right in front of the freeway. And by the time she was 2 minutes down, she was getting on the freeway. She could turn her neck to look to get onto the freeway. When before she got there, she moved her whole body. She couldn't move her neck. It can be
Wow.
that fast. And then other things we
Wow.
see, but like my hairdresser, it was 2 days. And actually now, her middle finger, my hairdresser, still stuck up a little bit, and now it's down 4 years
That is
later.
that is absolutely
And
amazing.
and
Almost
she's
too good
still
to
a
be true.
hairdresser. Yeah, things
Too good to
take
be true.
moments. Like sometimes you'll be in pain somewhere, and within 20 minutes you're like, "Oh, it doesn't hurt." So,
That is
it just
phenomenal.
depends on what it is, but it doesn't take very long.
Again, it just speaks to how wonderfully we are made,
Mhm.
that our Creator knew what He was doing and that our bodies do have the ability to heal itself. So let's segue a little bit more into the book. You wrote the book to create awareness about the treatment. Was that your motivation?
That was my motivation, yes, because like you, there's so many people who don't know that this is even possible. And so I just started writing down. It's really the journey my nurse and I have taken in the first year and a half, I think. I think it was about that long. And after I watched one thing heal up after another, I mean, I was in dentistry for 30 years, so I know um, there are failures. You know, you can't make everything work. And I'm watching this, and my nurse is like, she's like, I've never seen anything like this ever. I said, I know, never. So I just started writing down our experience, and before I forgot them, because you think you're always going to remember, but you
I
don't.
know. Yeah, yeah. So it's a
So,
collection of experiences basically that you're sharing to create awareness around this amazing, incredible
mhm.
um, self-healing ability that the human body has. How long did it take you to write the book?
I think it took me about, from starting to publish, it took about a year. Took a year. And I sat on my porch and, well, I heard this author, and they asked him how he was so prolific and how he could write so much. And he said, I write 200 crappy words a day. And I thought, well, I can write that. I can write 200 crappy
That's
words a day.
doable.
As long as you don't expect them to be good, I could do that. And then, then you get going, and sometimes I could write 500. And then, what I tried to do was write and not edit until it was time to edit. You know what I mean? Because or else you're writing that
Yeah,
first chapter over and over and over, trying to make it right where you got no volume. Um,
yeah, absolutely. Teresa, can I ask you to hold up the book?
oh, sure. It's right here.
So I mean, the cover is the simplicity of cover is wonderful because it gets the message across powerfully. So whose idea was the cover? Was that your idea?
Actually, I had a cover, a graphic artist, and she did a good job, though, didn't she?
She
Yeah,
did because I mean, it's the simplicity of what she's done is striking. It catches your eye. You know, you can't miss it. I think it the message across very, very powerfully. And also and the color of the book was that yours or did also that also come from
that
her
was my
idea? Was that
color.
also her? Okay.
That's the color I use in my dental office, and the color I use. It's really, it's the light's a little bit much in here. It's really more like a Tiffany blue.
Yeah. Yeah. No, it's very pretty and
So,
it's got a very shiny cover. It's very, very, very beautifully done. Can
oh,
I
thank
ask you
you.
to read your favorite section out of the book? Would you mind?
I don't know my favorite, but I picked um I picked one paragraph. So after I I treated my hairdresser, which, you know what? I bet you can see those pictures. This was though this was Monday,
Yes.
this was Tuesday, and the bottom
Yeah.
one is Wednesday.
That's amazing.
And you know what? I don't know even why I snapped that picture of her hand. I just did. So it's perfect. See, but God was involved in this,
But
obviously,
I
'cause
mean, it's amazing that you did take those pictures because now at least you've got proof of, sometimes when we heal, I know for me it's true. Sometimes when we heal, we forget how far we've come.
oh, no, all the time. I injected my left knee because, there was nothing wrong with it, but it was tweaky. I've been around here for a while using it. And so I kind of forgot. And about 3 weeks later, I realized, oh, my left knee doesn't hurt anymore. But then I felt my right knee. So then I had to inject my right knee. Now neither one of them hurt. So that's good. But you do find that sometimes once you get the most pain, the next thing shows up. It was really always there. You just didn't feel it.
I, myself living with chronic pain and so many different conditions, I also find that that happens. Sometimes one thing starts to feel better and then something else hurts. There's always something else hurts. You're thinking, can I ever get to a point where nothing hurts? But when
Maybe you
one
have to
thing
come
heals,
visit me.
I think so.
We'll inject your whole body.
Oh my
uh,
goodness.
so, what is this magical golden fluid inside all of us? How does it work? With every spare minute, I read everything about PRP that I could that I could get my hands on. And with the internet, that was a lot. I retired from dentistry, but PRP lured me out of retirement with its ability to heal, create beauty, and decrease pain. PRP has at least 15 healing factors and antimicrobial factors as well. God knew what when we skinned our knees, we would need protection from E. coli and staph. Just a little excerpt. It's kind of there's only one chapter with science, a lot of science. It's short. But I just wanted to make sure, you can skip that. It doesn't have a story, but that's the part I like a lot, studying
It's but
the
it's a
healing
it's a
factors.
section that's it's short but powerful. It actually it gets the point across very, very well.
Mhm.
It's impossible for us to go through life and never to hurt ourselves. You know, that's almost impossible. But we do have this amazing ability to heal, and it's something I often point out to people that when you're younger, you seem to heal faster, quicker. And as we age, for some reason, our bodies deteriorate and we don't heal up so fast. And with the treatment, as you discovered now, just using the body's natural ability to heal, um, just sort of fast forwards that process again, almost to the point where, we were younger and we healed up so quickly. And so the body just needs a little
Exactly.
bit of help.
Exactly. Exactly. It's just a miracle. That's why I wrote that. It's a miracle coursing through your blood. And we all have it. We just don't know we have it. Most of us never find that out. I just been blessed to be able to learn about this and treat patients, and they get better. That's so fun.
I know. I mean, that must be one of the most rewarding things to be able to know that you're giving somebody a new lease on life with something that's not going to hurt them either in the short term or the long term.
Right.
Um, but there can only but be a benefit. I think that must be a huge feel good thing to be able to do that for someone, for yourself, and for other people that you care about. It's a huge gift. Um, Unlike big
Oh, it's been a
pharma, that
huge gift.
because with big pharma, it's about keeping people in a cycle of illness so that they can keep making money and coming back again and again and again. Whereas being able to heal your body naturally is just a phenomenal gift in itself. And I don't know if we'll ever see a world in which we'll move away from this big pharma right now to where people would look more into natural. Thankfully, I think, due to the internet, people are becoming a little bit more um, educated, more curious than they were before because we've got access to information. Thankful
Mhm.
to technology that's working today. you and I can have this conversation and talk about your book and talk about this wonderful healing power that our body has from different parts of the globe. You know, how amazing is that? Um,
And that it worked.
and that it worked. Teresa, thank you so, so much. I want to thank our audience that's joined us today live, whether you're watching us on Facebook, on YouTube, on Twitter, on Twitch, um, LinkedIn, Amazon Live. Thank you very much for joining us today. If you are watching us over on Amazon Live, and if you aren't watching us over on Amazon Live, if you go there, you'll find that Teresa's book, You, Healing You. Won't you hold up that cover just one more time for us, Teresa? You can go and grab a copy of that book, You Healing You, over on Amazon. The book is in the carousel if you're watching us over on Amazon Live. So please go grab a copy, learn about others' experiences, and hear how you too can get access to healing your body naturally without any external medications with side effects. So go grab a copy of the book. Teresa, once
Thank you
again, I
so
want to
much.
thank you so much for sharing your story, experiences with people. Um, and I'm
Thank
glad
you.
that you came across this. I'm happy that you found out about this, even if it was accidentally, but that you didn't keep it to yourself and that you've shared it with the rest of the world. And now you've published it. So thank you very, very much for that. Much
Oh, thank you for
appreciated.
having me. I really appreciate it. Thank you so much.
It's an absolute pleasure. So thanks everyone. Take care, and we'll see you back on the next episode of Books with Bridgetti. Go well.